Hi there, I'd like for you to meet JC. She is a 29-year-old plumber. Oh, and did I mention that she's also a single mother of two beautiful 3-year-old twins? In her spare time, she likes to play racquetball. The thing is, JC is not too happy. She has been diagnosed with right lateral epicondylitis. Her past medical history reveals that this isn't her first time with the condition. Because of it, she now has a decreased range of motion with wrist flexion and forearm supination, as well as a decreased grip strength. What is lateral epicondylitis, you might ask? It is a painful condition on the outer elbow due to overusage causing the wear and tear of the tendon and the feeling of inflammation, aka tennis elbow, and is characterized by pain and tenderness. Because of this, JC has difficulty with many home-related tasks, and her workplace has also modified her duties. Let's learn about lateral epicondylitis to help her out. Similar to JC, those who have been previously diagnosed with tennis elbow are more likely to have it reoccur. Jobs and activities involving the use of the forearm and wrist are prone to the progression of the condition. One's grip strength becomes evidently weakened, and though tennis elbow can affect any age group, it is most common amongst adults in between their 30s to 50s. As we age, our tendons begin to weaken, which leads to higher chances of developing LE. Due to overusage, competitive athletes are also more susceptible to this condition. Performing a sport with poor technique can also increase your chances. Oh, and just a little FYI, oxygen deficiency can be caused from smoking and decreased circulation to the tendons, which lead them to weaken. Studies have shown a relationship between smoking history and incidences of LE. A general practitioner is able to tell if lateral epicondylitis is present by learning about the individual's daily activities, looking at previous injuries, looking at one's history of symptoms, and by conducting a physical examination. Physical examinations usually follow the general guideline of 1. Observations for signs such as swelling or discoloration, though with tennis elbow this usually isn't present. 2. Palpation and inspection of the joint for signs such as tenderness or an increase in temperature. And lastly, the movement of the joint to see if there is any pain and where the pain is originating from. These are the following symptoms of JC, noted down by her general practitioner. Elbow tenderness at extensor muscles upon palpation, the inability to perform internal and external rotation, pain in the lateral elbow when gripping or lifting an object, an increase of temperature of the long wrist extensors, and pain upon wrist flexion as well as forearm supination. Generally, no radiology testing is required, but the specialist may suggest an MRI scan to get a better look at the tendons and bones. There are two categories of treatment, either medical or surgical. Good news for JC is that approximately 80 to 90% of patients have success with non-surgical treatments. However, patience is required because the healing time usually takes about 6 to 12 months. This pretty much sums up our presentation on lateral epicondylitis. We hope you enjoyed it. Thank you.